Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Uterine prolapse. Causes of uterine prolapse. Uterine prolapse occurs mainly due to the weak uterine supporting system. Risk factors of uterine prolapse. 1. Menopause. In menopause, there is atony of uterus and there is asthenia of uterus. This atony of uterus and asthenia of uterus weakens the support of uterus, thus resulting in prolapse. If there is repeated childbirth or birth trauma. Repeated childbirth or birth trauma is most commonly seen in elderly or multiparous. So this is rarely seen in young and nulliparous. And this repeated childbirth or birth trauma is responsible for prolapse of the uterus.
thank you and thank you for watching.